Welcome to The Explainer. Today, we are building a mental model for one of the most common and honestly one of the trickiest complaints you'll see on your board exams, bloating. Our whole goal here is to give you a super clear, step-by-step framework so you can crack this case every single time. So here's our game plan. We're going to start by really nailing down what we're talking about. Then, we'll get into the single most important diagnostic key. This one's a game changer. From there, we'll profile all the main suspects, test our skills on a related case, and then finish up with the ultimate cheat sheet you'll want in your back pocket for exam day. All right, let's get right into it and solve this bloating mystery. You know, in diagnostics, being precise is everything. If you can get this first step right, knowing what fujang is and what it isn't, you're setting yourself up for a perfect diagnosis. So, picture this. You're in the exam, the clock's ticking, and you get this question. A patient has bloating. It's vague, right? Your first move is absolutely critical. You've got to narrow down the possibilities, and you've got to do it fast. You know, the first thing any good clinical detective does is rule stuff out. And this is your first crucial distinction. Fujang, what we're talking about today, is fundamentally a qi problem. It's a traffic jam of energy. It is not a fluid problem like ascites, which comes with that classic drum-like belly and changes in urination. This is your first major fork in the road. Right, so just to be super clear, what we're hunting down here is a qi traffic jam in the abdomen. The patient feels full, they feel blocked, all because their spleen and stomach qi just isn't moving right. And here's the key takeaway from this slide. The diagnosis is all about that feeling of obstruction, not necessarily about pain or even visible swelling. Okay, this next part, this is the absolute master key to your diagnosis. Seriously, understanding the difference between excess and deficiency is so incredibly high yield for your exams. Let's really lock this concept in.
And this analogy is just perfect. It makes it so easy to understand. So ask yourself, is the qi traffic jam happening because there are literally too many cars on the road, like stuck food or phlegm? Well, that's excess. Or is the problem that the engine's just too weak to move the cars along? That's deficiency. See how simple that is?
And this table, wow, this is your secret weapon. 3 simple questions, and boom, you've just cut your differential diagnosis in half. If your patient says the bloating feels worse when they press on it or right after they eat, you should immediately be thinking excess. But if they say pressing on it actually makes it feel a little better and it gets way worse when they're tired, you're definitely on the trail of a deficiency pattern. All right, we've got our master key. Let's go unlock that first door, the excess patterns. These are the ones where something is actively, physically blocking the free flow of qi. Okay, this slide right here is pure gold for your exams. I'd pause and just memorize these connections. If an exam question mentions foul belching that actually brings relief, your brain needs to scream food stagnation. Distension that gets triggered by stress, that is your classic textbook liver qi stagnation. These buzzwords are your shortcuts straight to the right answer. All right, let's flip the coin and dig into the deficiency patterns. Now, with these cases, the issue isn't some physical blockage. Instead, it's a fundamental lack of energy. The spleen and stomach are just too weak to keep things moving along properly. Now, pay attention to the subtle but really critical differences here. See, both qi and yang deficiency are going to give you fatigue, right? But the clincher for yang deficiency, it's that element of cold. Feeling cold all the time, seeing undigested food in the stool. Yin deficiency, on the other hand, is all about dryness and that kind of empty heat, with that classic red, peeled tongue. Okay, you've got the theory down. Now let's put your new detective skills to the test. We're going to use the exact same framework we just built, but for a really closely related complaint you'll see all the time, anorexia, or loss of appetite. And the keyword here is severity. We're not just talking about someone who's a little peckish. No, this is a complete shutdown of the desire to eat. And that's a big deal, because if the body can't get qi from food, it has to start dipping into its precious foundational reserves. And now, take a look at this lineup of culprits. Do they ring a bell? They totally should. Liver qi stagnation, spleen deficiency, phlegm damp, these are the exact same patterns we just investigated for abdominal distension. See, mastering one directly sets you up to diagnose the other. It's a 2-for-1 deal. All right, deep breath. This is the slide you've been waiting for. We've gathered all the clues, we've profiled all the suspects, and now we're putting the entire investigation together into one powerful, high-yield cheat sheet just for you. Seriously, pause here if you need to. Burn this into your brain. This is your board exam powerhouse.
Matching that key symptom with its classic tongue and pulse is the fastest way to get the correct answer. Food stagnation gives you that greasy coat and slippery pulse. Liver qi stagnation? It's got to be that classic wiry pulse. Nail these combinations and you'll be absolutely unstoppable.
Voltaire famously said, "The art of medicine consists of amusing the patient while nature cures the disease." And it's a great quote, but for you as a modern practitioner, your art is in precise pattern differentiation. That's what lets you go beyond just managing symptoms. It's what empowers you to help nature along, to facilitate real deep healing. So what did we just do? We took this huge, messy, complex puzzle of bloating and we turned it into a clear, logical map. You are now totally equipped to confidently tackle these cases, whether it's in the clinic or on your board exams. The mystery of abdominal distension, it's solved. Now go solve the next one.